Mental illnesses can be as debilitating as, if not more than, physical illnesses. Many people go through their lives with varying mental conditions that make living tedious for them, but finding help has become easy, thanks to psychiatrists. Nonetheless, it takes a lot of hard work to become a psychiatrist. If your life dream is to help people with mental health conditions, you may consider a career in psychiatry. Before we continue, please subscribe to our YouTube channel by hitting the subscribe button below to get a notification on our next video. So, a psychiatrist is a professional whose main specialization is diagnosing and treating mental health conditions such as anxiety, schizophrenia, depression, ADHD, eating disorders, and many more. Many psychiatrists specialize in treating a specific type or a set of mental health disorders. This medical profession surprisingly comes with a ton of pecks. A primary reason many psychiatrists are interested in the field is its flexibility. Psychiatry is one of the few fields of medicine where you can have a normal day. You're less likely to be on call, and you can tailor your itinerary to suit your family's needs. If taking care of your family isn't a priority, psychiatry gives plenty of opportunities to work and travel. Psychiatry, like other medical professions, is founded on scientific facts, and it works. So, you can make a significant difference in the lives of your patients. Patients who are indefinitely institutionalized can be treated so they can have an everyday life. Psychiatrists have a one-of-a-kind potential to enhance their patients' mental health and well-being. Being a psychiatrist gives you room to assess and treat your patients' mental health challenges. You'll also be able to empathize with your patients to treat them effectively. Psychiatrists, more than many other doctors, exhibit empathy on some level. This means you get to know your patients in a way that few other doctors do. Psychiatrists must be empathic not only in terms of comprehending that their patients are struggling, but also in terms of recognizing how a patient perceives their condition. It's not merely about facts, information, tests, or treatment. It has a lot to do with personal and scientific connections. Medical students learn essential skills in psychiatry, such as how to build meaningful interactions with patients. To effectively treat their patients, all doctors must be able to establish positive relationships. Notwithstanding, what is a psychiatrist's job description? Psychiatrists have a one-of-a-kind opportunity to improve their patients' mental health and quality of life. As a psychiatrist, your job requires you to assess and treat the effects of mental illness on your patients and assist them in reintegrating into society. You would have to deal with your patients on a one-on-one basis to listen and care for them. Managing their mental condition is also part of the job description. This means you'd have to prevent, identify, and treat mental health disorders. Additionally, you may be expected to lead a team or teams of healthcare professionals. Teaching prospective psychiatrists, running research, and supervision are also part of the job as a psychiatrist. You can't gather all that knowledge without getting good pay from it. The range of psychiatrist salary depends on several factors, including the level of education, type of certifications, professional experience, and years of experience in your field. As of July 28, 2021, the average psychiatrist income in the United States is well over $230,000. However, the range is typically between $210,000 and $260,000. While the profession attracts impressive pay, becoming a psychiatrist isn't a cakewalk. Aspiring psychiatrists must complete high school or obtain a GED before applying to medical school. Several medical schools demand that students have completed 1 year of physics, biology, calculus, general chemistry, and organic chemistry. Also, an impressive GPA can improve your chances of getting into medical school, and selected applicants' average GPA is 3.71. After that, students are required to take the MCAT. This is the entrance exam for medical school. Accepted applicants must have an average score of 511 points from the 528 points. MCAT is a 7.5-hour exam divided into 4 different sections, and they include biological and biochemical foundations of living systems, psychological, social, and biological foundations of behavior, chemical and physical foundations of biological systems, and critical analysis and reasoning skills. The next best move is to apply to a medical school. There are tons of those in the United States, and hopefully, you get to graduate med school in 4 years. Residency comes after you apply to be a licensed doctor. Experts advise you to complete your 4-year psychiatry residency in the state you wish to practice. Here, you'd be introduced to a broad spectrum of mental health disorders, which will usually take place in a hospital setting. What comes after is the American Board of Psychiatry and Neurology, or the American Board of Physician Specialties. Although optional, many psychiatrists prefer to be certified. You are also required to recertify every 10 years by taking the board certification test. Again, most regions in the U.S. require that doctors who wish to retain their license must complete a stipulated number of continuing education credits. The time required to become a psychiatrist differs from one person to the next. Some individuals take longer than others, while others take a year or 2 off after college to prepare for the MCAT. In most cases, some students will be able to finish college sooner than expected. Let's assume there are no breaks and a person graduates on a regular schedule. It would take 4 years of college, 4 years of medical school, and another 4 years of residency. That sums up to 12 years following high school. The average cost of becoming a psychiatrist depends on where you went to school, whether or not student loans are received, and whether or not they live in a high cost of living region. Out-of-state students attending 4-year public institutions pay around $23,890 yearly tuition, which sums up to $95,560. Mind you, this does not include the costs of food, books, accommodation, and board, or student fees, which usually run into thousands of dollars per year. On the other hand, out-of-state students spend an average of $58,668 in fees per year, summing up to a total of $234,672 in 4 years. Accommodation and board, books, and other expenses might boost the price tag. Hence, the total cost of medical school plus college for an out-of-state public school student can be over $330,000. Those attending public schools in their home state often pay less, whereas students attending private schools may pay twice or triple the amount. Lastly, a doctorate in medicine, or MD, is required for psychiatrists. Prospective psychiatrists are to attend medical school to pursue a career as a psychiatrist. This entails first earning a bachelor's degree in a science-related discipline or enrolling in science-based undergraduate courses. Hope this video was helpful. Thanks for watching. Please share your opinions in the comments section below, and remember to click the subscribe button to be the first person to watch new videos on this channel.